Hi everybody, it's Tamborine Borrelli and I'm here at Forza Coffee in Lacey. They've got the best coffee in all of Lacey and Olympia area. Well, maybe not all of Olympia area. But we're here, we're talking about the new Medicare for All Act of 2017. It was just released yesterday by Bernie Sanders and 17 senators, including Bernie. And basically, we've just been talking about all the different ways in which the proposals are as far as funding. We've also gone through the rollout, the phase for the 4-year plan, which many people aren't aware of, that this particular bill, once enacted, will take a 4-year plan. So we might get into that a little bit, but first I just wanted to go around the table and let you hear perspectives of real life people, why they think that this bill is a good idea, and just giving you a couple of their personal examples. So we're going to start with, say your name.
Pat Delaney.
Where are you from, Pat?
I'm here in Olympia.
So tell us why you think that the expanded Medicare for All Act is a good idea.
Because too many people are without health care. Because as a senior, I am impacted by any change, any cost, anything that comes up, and I'm being taken advantage of. But it's a racket. They charge you for things you don't need. They frighten you with what's going to happen to you, and you have to worry. I had a very expensive hospitalization this year, and I was terribly frightened. I have a $5,000 deductible. They did not charge me that. It turned out well, and I have more medical coverage than I need right now, but we can't have people be afraid, unwilling to get health care.
So this was an unexpected, like you went in for one thing and then it turned out to be more of an issue where the surgery was, I think you said like $50,000?
I had a simple surgery which caused pulmonary embolisms, and the bill was about $45,000 for the treatment.
And you presently have Medicare, correct?
I have Medicare and a Medicare Advantage plan.
And so, based with those programs, you ended up paying how much?
$1,300.
So considerably less. So this is kind of an example of what a situation might look like. With the expanded Medicare, however, that would be next to nothing.
Right.
So even better.
Yeah. and I think it's unfair to promise people health care, promise income, promise Social Security, and then gut it. It's, if you can't afford your medications, if you can't afford the treatment that you need, I would have died. I had a 50-50 chance of living, and I would have died if I didn't have Medicare. They know what Medicare will pay, so therefore they covered it. But we shouldn't be put to that extreme in our choices.
Pat, if you can, you took great notes. I was watching you when we were talking about how this next 4 years is going to look like with the phase into this Medicare for All Act. Can you tell us what the first year will look like?
Well, the first year includes the seniors that are covered now.
And at what age?
55.
Mm-hmm. And what else is included?
All children under 18, which I think that's where we should start with good health care. It will include dental, vision, and hearing aids. I'd love to hear everything.
And then the second year, the requirement age continues to...
Second year goes down to 45, third year goes down to 35, and by the fourth year, everyone's covered.
Okay, awesome. Well, Pat, thank you for sharing with us.
Okay.
And who do we have here?
Oh, I'm Dane Farrell.
Hi, Dane.
I'm sure everybody knows who I am, or most people, but yeah, I support Bernie's bill. I think Medicare should be a right that we're born with. We shouldn't. I've seen people who are sick and can't afford to go to the doctor. I have Medicare now because I'm disabled, but before I had heart bypass surgery and had no insurance, and the bills were $200,000. How was anybody supposed to pay for that?
Right.
I asked for Medicare. It should cover more things. I think the Part D thing is a joke.
Prescription.
Yeah, prescriptions. Yeah, when I go into the donut hole, it's over $1,000 a month for my prescriptions,
Yeah,
and that's insane.
yes, it is.
We shouldn't have to live that way and worry about getting sick because we can't afford it.
We agree, Dane.
Yeah, okay. That's kind of all I really got to say about that one. So, but I think Bernie's bill would be great. The phasing in part, I know that would be tough for some people, but it would basically keep Medicare from being overwhelmed too, where they wouldn't have enough staff, et cetera, to help people. So,
But overall, thumbs up.
yeah, overall thumbs up. Yeah, it would be great, fantastic.
Awesome. Thanks, Dane.
Mm-hmm. Oh, you're welcome.
Hi, Chelsea.
Hi. So I'm Chelsea Rustad, and I live in Tumwater, and I'm supporting the bill for expanded Medicare for all because, like Patricia mentioned, I think it's so important that people know that even though the bill won't go, fully into effect until 4 years in, it will be phased in gradual increments. And the first year alone, dropping the age to 55 years old to be eligible for Medicaid or Medicare that would include my parents, who are currently spending pretty much every dollar that they have for my dad's cancer treatment and monitoring and tests and everything with that. It makes the difference between struggling to get by month to month and having any chance of thriving later in life, when pretty much every single one of us at some point will experience medical issues as we age, or as we experience a medical condition that was unforeseen for whatever reason. And when that happens, we need to know that there will be protections in place so that you can get the care that you need, no questions asked. So,
And Chelsea, share with us, you were just telling us when you were canvassing, when you were knocking on doors, you came across someone that was going to, you said, move to Mexico? Because
that's right. And so I'm running for Tumwater City Council, and as I've been doorbelling in my neighborhood, I spoke to someone who said that, as I mentioned, since everyone will probably experience healthcare issues down the road, when he gets older, his plan is to pick up and move to Mexico, because then he knows that his healthcare needs will be covered, guaranteed. We are surrounded on all sides by countries that are already providing universal healthcare, and the politicians in our country are sitting here debating and talking about like it's impossible and it's impractical and it's not fair. These are our taxes, and we should use them in the way that does the most good for the most people. We already have so many corporate subsidies going out to protect giant corporations from failing, and what about the human beings that live here that every single day are being failed because they have to pay exorbitant amounts for their prescriptions, for their care, or they simply don't have access to any kind of health care because they're uninsured. That's who's being failed right now. And healthcare is a human right. And any step that we can take to get there, including the incremental steps that it will take to fully realize the vision of coverage for everyone in the country, is one that I support.
awesome. Thanks, Chelsea.
Hi. My name is Stephanie Jankowski, and I am here in Lacey. And I support this bill for several different reasons. The number one reason, I think, is because of everything that is included in the bill, specifically the mental health and the substance abuse treatment options, because as a social work student, that is something that we discuss quite a bit. We have an opioid crisis right now happening in the United States. So being able to provide adequate, comprehensive treatment to people who are struggling with substance abuse issues and mental health crises, that is a pretty good umbrella way of addressing the issue and creating some kind of solution, and bettering these people's lives economically and in a health related way. The second reason why I support the bill is because of the percent drop for administrative fees. So right now, the Medicare, 18% of our medical expenses goes towards administrative fees. With this bill, it'll be dropped down to 2%. And that is an incredible amount of money that's feeding back into the economy that can be put towards other things. So simply dropping the administrative fees down to 2% is a huge benefit. And the third reason why I support the bill, I think, is because kickstarting this kind of idea sort of creates a positive feedback loop whenever it comes to working with families and businesses and their roles in the economy. So what you see is savings for businesses, which puts more money back into people's pockets, which then feeds back into our economy and creates a freer market with actual, monetary resources. So for me, those are three big areas that I feel are a massive benefit for everyone in the United States. And this bill, I think, is really the beginning of getting something good going. And I think that's about it.
That's awesome.
Yeah.
Thanks, guys. So we don't want to make the video too long, but we will be adding maybe in a PDF or maybe in another short video, just the proposal. It's not actually officially included in the Medicare for All Act of 2017. These are a list of proposals in regard to how we can actually approach paying for this, because that's always the number one question that people ask. Well, how are you going to pay for it? Before we actually get into those details, I'll just leave you with this. If everyone knew that right now our country per capita pays $10,000 compared to Canada spending half that, $5,000 per capita, and everybody's covered there. So we pay presently twice as much, and yet we are approaching almost 30 million people who don't have any insurance, not to mention those who are grossly underinsured. So the money is there. We just have to come to the realization that we can no longer accept the excuse, the gamut of excuses given to us by the corporations, the healthcare industry, the pharmaceutical industry, the medical device community. We cannot accept anything less than the fact that everyone else, every other country, whether it be Canada, Spain, Italy, Germany, everyone is able to offer this type of care to their citizens. And being the greatest country in the world, we have to start taking care of our own. So look for that video or that PDF, and we'll do a rundown of the proposals of how and where the money can come from. Thank you so much for tuning in to our little coffee chat about Medicare for All, and you'll be hearing from us. Thanks.